Hello, this is Dr. Drew Hall here from Los Angeles again. Upper Cervical Healthcare, Los Angeles, Carson. Those are our two offices. So what I wanted to talk about today is fibromyalgia. Fibromyalgia is a devastating condition. Anyone who has it or anyone who lives closely with someone with it knows how devastating this condition can be. But what I want to do today is I want to talk about a little hope. There's things out there that you can do that can give you relief and can help move your body in the direction of healing. What I first want to talk about, since it relates to upper cervical care, which is what we do in our office, in 2002, there actually was a Barbara Walters special, and it was a neurologist who dealt with a lot of fibromyalgia cases. And being a neurologist and understanding brainstem anatomy and neurophysiology, started to kind of link most of the symptomology that fibromyalgia cases had back to brainstem function. And then he started taking MRIs and started to notice that most of these people lost the curve in their neck and had tensile stresses on the brainstem and spinal cord, and pressure actually, by looking at the MRIs on the brainstem. And what they started to do is they started doing surgery on these people. And what they did is they cut the back half of the atlas off and part of the skull. It's kind of a Chiari surgery, if you want to look that up. Chiari is a type of surgery they do to relieve pressure on the spinal cord. And these people actually got fantastic relief rather quickly after the surgery. And then later on, unfortunately, most of them started to have all sorts of problems because you're actually supposed to have that bone in the back part of your neck and your C1. But the reason that's intriguing for me as an upper cervical chiropractor is we've seen patients with fibromyalgia do quite well under upper cervical care. And so instead of cutting the back part of your C1 out or your head to relieve the pressure, what we do in our office is we're interested in how does C1 fit to the bottom of the head. There's a joint here, there's a joint here. C1 fits here, and through that hole runs your spinal cord, right? So and what we do find in the fibromyalgia cases I have taken care of in my office, 90% of them have had either a big whiplash injury, a slip and fall, that had some sort of injury prior to the onset of their problems. And so in our office, we run a battery of tests that determine whether your first vertebra in your neck is where it should be, whether it's under the body's control or it's locked out of position under the skull and it's stuck and it's impacting you neurologically. So once they come in, we run those tests on them, and this goes for any case that comes into our office. We want to know, is the vertebra locked? And if it is, let's get it back where it should be so the body can function better. And what we find by correcting that structural problem in the neck, we find that most of these cases improve dramatically. Some of them completely recover, and others need other modes of care out there in the alternative arena. We found that fibromyalgia and chronic fatigue syndrome, these people should be co-managed with a functional medicine doctor. Functional medicine doctor is someone who takes a bunch of blood tests and other indicators and looks at them to see which part of your body is malfunctioning, and then through natural means supports your body. And in very rare cases that they have to, they'll use pharmaceutical medication, but they are bent towards helping you in a natural way. Because like I tell my patients, if you have health problems, I don't care if it's fibromyalgia or headaches or migraines or depression or low back pain, whatever it may be, you have to do something that actually helps your body function better. When the body functions better, it's able to heal better. And so while medications do have their role in our healthcare system, it's not healthcare and it's not going to make you healthier. You've got to do something that actually coaxes and helps your body back towards healing. So if anyone you know has fibromyalgia, have them investigate upper cervical chiropractic care, have them investigate functional medicine. I'm darn sure if you investigate and get under care with both of those procedures, you'll be happy that you did, and you'll improve. Of course, none of us have all the answers, but correcting your upper spine absolutely will help your body function better. And that's what we're after. Hope you all have a great day. Hope the information was helpful, and hope to see you fibromyalgia cases in our office, where we offer a free consultation exam here in Los Angeles. All right, have a good one. Health and healing to all of you.